let's start. So what do you see here? So give me some ideas on how to describe this thing that you see in the screen.
Fun.
Huh?
Fun.
Okay, what else? How do you describe this thing here? Just give me a little bit more. Huh?
Well, is wearing a mask with things in mind.
Okay.
Precisely.
Oh, okay, cool.
Prepared.
Huh?
Prepared.
Okay.
Overhyped.
What is it?
Overhyped.
Yeah, you're not a healing person. I agree.
Consider it maybe.
Okay. I found like really interesting that we're like, you know, that PowerPoint now describes the photo that you put on the PowerPoint. So if you look and you click on it, they describe the photo for you. And I found it really interesting that PowerPoint described this as a person holding photo. Instead, like the classic, like Mona Lisa, like she. Okay, and I think that was at least very interesting for me because I think that we live in a very binary world. And then having PowerPoint say, non-binary, that was like actually pretty cool for me and impressive. So I never seen it because traditionally we describe the Mona Lisa as a she, yeah? And that is what is wrong sometimes with the world, but I think that I'm not gonna get into that today because I may cry. So I'm gonna leave that apart and then I'm gonna go likely drinking some wine after this, okay? So my name is Carolina Camacho, Ruiz. My pronouns are they, them, please get them right in the clinical area. So multiple times, if you made a mistake, please just apologize, don't hammer on it that much. I want to protect you from your feelings of making a mistake. That is your job, not my job, okay? Just let it go now. And then I'm really like excited to be here today. We're gonna start our like I will call it my queer series in conference. And I'm not an expert on learning also, so I'm here just to bring some curiosity, have a conversation and between everyone to learn a little bit more how we can be better for these patients in the ER, okay? And for this lecture, I took inspiration from a case that I had when I was an intern. It was with Dr. Schechter. I'm sad that he's not here because I think that he will remember this case just because it was really impressive. She was I don't remember her age, like young, 25. Trans woman, recently have a vaginoplasty at NYU, like less than a week, and with active bleeding from the genitals, like active, like a lot of blood coming. And she was so pale. I never seen someone so pale in her life. And like she was really, really pale. And you know, we did all the things like, but what most impressed me the most is that we didn't know what was happening at all. And also, the staff, none of us knew how to talk to her. And kind of like, plus, think about the nursing staff, how much misgender was in that room. And it was really painful for me to see it and also feel unprepared and also feel the patient feel so disappointed every time they go through it. Plus being so sick also. Hypotensive, her hemoglobin was 2. So she had like massive amount of blood coming from the genitals, okay? So at the end, she was transferred to NYU, and I hope that in there she was treated better because I still feel shameful of that day that we have her in the ER, okay? So my objective is gonna be review terminology and definition with regard to transgender and gender non-conforming people, discuss cultural humility and competency among the physicians in regard to transgender health, and practice how to perform a history taking or physical exam, okay? So this is the beginning of kind of like a series. So today we're gonna be really simple to see how we can learn how to introduce ourselves, answer questions that are relevant for this patient, and also think about what we're gonna do with the physical exam when we have a patient that has surgery or having some difficulties or identify the self-difference. So the physical exam is gonna be really anxiety producing. So I want everyone to be ready for that, okay? So what do we know as physicians? After doing some research and reading some papers, I think that the safest thing to say is that emergency physicians have a large knowledge deficit regarding medical care of transgender and gender non-conforming people, okay? And this is what transgender people say. Transgender adults who visit the ER overwhelmingly report that healthcare providers lack competency in issues specific to transgender community, lack experience with a knowledge of language, and trans-specific treatment, such as hormone therapy or complications of gender-affirming surgery. They felt that going to the ER was a dehumanizing experience, made them feel like a freak show. Other people say
I gotta educate you on something that I feel like you should know already, okay? Do people with chest pain teach us about ACS? Nah, yeah? So what we're expecting these patients to let us know what they're going through. And that is not cool, at least in my opinion, okay? We should be ready, okay? And I think that that is the reason that this presentation is very important. No one ever in your present should be feel like a freak show going to the ER, okay? And it's your job also to stand for them and make the experience a little bit more pleasant, okay? Because they need the care, but they don't come to the ER because they really hate it. And like I have a lot of like transgender patient friends, and they say the same thing to me. And just of note, they hate coming to Kings County. And that is so sad, you know, they really hate coming here. So just something to have in the back of your mind that we need to do better, okay? So in 2013, there was a study that found that only 26% of the EM residencies have any topics about this in their conference. And all of them were less than an hour, okay? And in 2019, the model of like clinical practice of emergency medicine add-on to their rules like gender identity, sexual orientation, and transgender care to the core content adopted by the American Board of Emergency Medicine. And after that, in 2020, 75% of the residencies offer a little bit of time in the curriculum. It's usually less than an hour. So can you imagine? That is really short. It's usually higher in places that have queer and residents and attendings also, or university and county-based programs, okay? But still, it's less than an hour. And also that is really taxating to the queer attendings and also to the residents also, because that means they've been pushing the movement, and that should not be the case, okay? It should be already included, okay? And so just for terminology and to help you navigate your life and also patients, okay? So what is gender identity? Can someone give me a little bit of definition? What? Okay, so thank you. Is the person internal sense of self and how they fit in the world in perspective to gender, okay? Gender expression is how you express it outside, okay? How you are like your outward manner, okay? Sex is historically being referred to what you were assigned at birth, okay? And that is determined based on genitalia and chromosome, okay? Remember that gender identity and gender expression may diverge. They don't have to be the same. And also remember that gender is really a social construct, okay? Nothing else to say. That is for me the final definition. Okay, and then a transgender person is someone whose gender identity differs from the sex assigned at birth, okay? And it's usually abbreviated as trans, okay? A transgender man is someone with a male gender identity and a female woman birth assigned a sex, and a transgender woman is someone that was assigned, and then a transgender woman is someone that was assigned male at birth, okay? And then someone that is not transgender will be referred as a cisgender, okay? And then when we talk about trans people, we should identify them always by the gender that they currently identify of. And then if you need to refer because the presentation make you like kind of, you have to explain, you can put also assign this at birth, okay? And I want to like really like talk about this a little bit more. And I will like explain how you can write this in your notes because I see it that is right, usually wrong, okay? So gender non conforming is someone that their like gender identity differ from what was assigned at birth, but it's a little bit more complex than transgender people. Non-binary is someone that identify has neither female or male and use pronouns like they, them, someone like me, okay? Transsexual should never be used. That is an old term and it's disrespectful. Never use that term, okay? And then how we should document our notes, okay? So we can put like whatever, 25-year-old trans woman. And if it is relevant to what we're doing, you can put assign this at birth, okay? No M to F, no F to male. That is, you should not use that term, okay? I didn't use what is like medically necessarily and also correct, okay? So no more of that. And also, their dead name may be still in the chart, okay? because maybe they don't have like legal documents yet. So you can still see that it's gonna be the dead name, okay? You can edit it and you can put this a part that you can put what is their name that they go by right now, their pronouns, also what they were assigned at birth, and also put it in your note, okay? So that everyone like kind of like know what is happening, okay? And don't make any assumptions, okay? So how you identify a trans person? Only if they tell you that they're trans, okay? You can start your encounter kind of like asking, how do you self-identify, okay? We have certain biases and social norms that usually transgender people like challenge, okay? And it's really hard sometimes to unlearn our typical information gathering. And I understand that this is hard for many people, and it's okay to ask questions, just in a respectful way. If you don't ask, you will miss the opportunity to create an environment of safety, patient-centered care, and collaboration instead of like, I will tell you what to do, okay? To these encounters, just bring curiosity also. If you don't know, also be honest. I want to go and read because I really don't know. I really want to help you. So I think that that is a first important step. When people ask me what do you learn at Kings County the most, it's like, I know how to say, I don't know. Okay, and then I will take a time, I will read it, okay? And then I will come back with that knowledge and I will try to give it to everyone, okay? And can someone describe gender dysphoria?
Especially kind of doesn't agree with your gender expression or gender identity.
Yeah, so it's like distress, a significant distress of impairment due to feeling that there's incongruence between your individual experience or your expressed gender and the gender that you were assigned at birth, okay? And it will manifest in many, many ways, including like psychological discomfort, social challenge also, and also like depression, and also will not let you function in your daily life, okay? The experience of gender dysphoria is very like widely different among every people that is feeling it. And as I told you, we'll have a lot of like very different expressions in your social life and consequences also. There's also transphobia also, like you have gender dysphoria, but you're also transphobic. That is like super complicated. So I'm not even gonna go on that, okay? And a lot of people will do a multidisciplinary approach to kind of like deal with this. There's gonna include like mental health support, hormone therapy, also potentially gender affirming surgeries tailored to every individual needs, okay? It's a big menu, okay? And not everyone is in the same menu, okay? Some people do this and the other thing. So you have to be clear and ask the questions to understand what they are in the spectrum, okay? And then some gender affirming interventions that people would do to like manage their gender dysphoria can be hormone therapy, gender affirming therapy, speech modification, genital talking, genital packing, chest binding. So there's a lot of things out there that people are doing. And if you as a physician don't have like any idea, then you're gonna like miss it. Imagine someone with chest pain that is doing chest binding 24 hours a day, okay? And they're using ACE wraps because they don't have enough money. They're gonna come likely with chest pain. But if you don't ask that question, you're gonna miss it. And then you're gonna do a troponin on this patient because they're like 23 and the EKG is normal. You're like, I really don't understand. It's like, yeah, because you didn't ask a question, okay? So let's start a little bit talk about history and physical. That is what I really want to spend some time. So knowing the questions to ask, knowing the practice will help you to guide your assessment and your workup. Add these questions that we're going to discuss to your regular toolbox of gathering information. I also have in mind that it's relevant only when it's important to the presentation, okay? If someone comes with a finger pain or laceration, I really need to ask them why was there such short story? Not really, but just have that in the back of your mind, okay? Let's practice. My name is Carolina Camacho. My pronouns are they, them.
All about the background.
Okay. So my name is Carolina Camacho. My pronouns are they, them. What is your pronoun? Oh, so easy, yeah? Well, we don't do it more, yeah? It's like normal. Now I live in a non-binary world. So for me, everyone is like they, them until you prove me otherwise, until you tell me. So I like kind of like lead with that because it helped me to be more respectful and also open the conversation in a better way also. To be fair, I don't ask a 65-year-old woman from Haiti
what are your pronouns, because I think that they're gonna, sometimes, I try once, didn't work, okay? So, just have that, so, but like with more gentrification in the neighborhood, we start seeing that we have more gender, like non-conforming people, more transgender people coming. So just be ready for that, okay? Doing this is likely gonna be the most critical thing that you can do in your exam and your history taking to put this patient at ease, okay? And be able to, and them to be able to open to you and get the information that you need from them to like take care of them, okay? If you make a mistake with language, apologize, move on, okay? As I told you, they don't have to rescue you for your feelings of like you're not ready, okay? That is really a lot of work, okay? So say, I'm so sorry, I will do better and do better next time, okay? Don't like, oh my God, I'm so sorry, it's like this, I don't know how to do it. It's like, don't do that, okay? That is really uncomfortable, okay? So, it's just different type of pronouns that everyone use, like, you know, several menu. And then that was, I would say for me, they're very hard to like use them, but a lot of people use them, like you have to be respectful with them, okay? In Spanish, oh, so hard to use pronouns because we have a very particular language, it's like very binary, okay? Everything is like O, A at the end. Oof. Yes, so, but there's a lot of like menu there that you can choose, okay? So the next question, after you introduce yourself and you know their pronouns, and you can also always ask them what their name is, what they prefer to be called, or how identify. Also when you ask their pronouns, okay? So your name is this, my pronouns are that, tell me your name and what pronouns you use, okay? And then you can ask them what sex were you assigned at birth, okay? And then they will like kind of help you to keep moving forward, understand what is gonna be your focus in your exam. Some example is someone come with abdominal pain. It will be important to know that. And also for proper treatment. And then you can ask them how you describe your gender identity. Okay, so you also like know how to treat them, how to call them, and also like do it by help you with this kind of like diffuse with the staff, because it's gonna be hard with the staff at Kings County. It's really, really hard. Okay, and I be in the position and I try, and I think that some of the new nurses are doing a really good job and they're like more respectful, but other ones are really hard. PCA is terrible, really, really hard, okay? And then not all the trans patients will be taking exogenous hormone or have any like surgery at all to change their physical appearance. So it's essential to obtain history from every trans patient to provide appropriate care. An initial question that you can ask them is, have you pursued any changes in your appearance or your body to bring you closer to your sense of self? Okay, this is a great question. You can like phrase it as you want it, easier, but I think that this one actually will elicit a really like good response. And then if that doesn't work and you're unable kind of like to get all the information that you needed from them at that moment, your next question can be, have you ever or are you currently taking exogenous hormones or any other medications related to your gender presentation? Okay. If they say yes, ask from where they're actually buying them. Okay. A lot of people are buying in the black market. They're like mixed with other things, or they're like reading on the dosing that we're supposed to be using, and that is like dangerous. For everyone, HAC has a great price center. So you can go to Ambu Referral and it's not in the database, okay? And it's called Pride. All right, so you can refer them to Bellevue. There's one in Bellevue, there's one at Woodhull. And I heard by Dr. O'Callaghan that is a really good clinic. So a lot of patients are going there and they actually call them and follow up, okay? If they don't want to go to HAC for whatever reason, you can also refer them to Canning Lord. It's like really easy, there's multiple in the city, okay?
You do have to where referrals to there or?
Yes.
What's the name of the clinic?
Pride, the Pride.
And then you choose on that.
Yes, you actually work the children.
You're saying the follow.
Yes, I think there's one in Woodhull, Bellevue. There's a couple, but I remember that too.
Was there a preference?
No. You can ask them the patient where they want to go, but I think that the Bellevue one is the bigger one, okay? Yeah.
It's just a pharmaceutical clinic or the whole thing?
No, it's a whole clinic within the second area approach. They also have, they are surgeons also working with them, therapists also, and what I heard is really good, okay?
So if they don't wanna go to a visit center, they can go to calendar, where there's many, many clinics in the city, including Brooklyn Hospital. And they're really, really awesome. And they also do multidisciplinary approach. They have like PCPs, they have like GYN, psych people in there, and it's really cheap also. Okay. So about surgical history, ask them, have you ever had or thought about having any surgeries to align your body with your gender? Knowing if your patient has any kind of surgery and what kind of surgery they have and how recent and where they had it, it will help you to get your physical exam and what is going to be your workup and your disposition, okay? And are you sexually active? Be a sex positive physician, okay? Like, come on. Everyone has sex. Good. Just be positive, no judgment, and help them to actually do it in a safety way. If they're not taking any prep, say, hey, what about you thought about getting like prep or post after? And then refer them to the clinic. Okay, they're gonna do everything in there, okay? And also, have you experienced any physical, sexual, or emotional violence recently? That is important. There are like very transgender and gender non-conforming people are very at risk of having experienced like violence in their life, okay? And then you can continue with have your mood been, have you ever been feeling like depressed or hopeless? Have you ever thought about hurting yourself? Do you have enough support? You have friends, you have family. Who is your chosen family that are helping you to go through all this that you're going through, okay? And then the physical exam can be very traumatic and very anxiety producing. So be gentle, be kind with them. And I want you to add this knowledge also to your toolbox or physical exam skills. It's gonna be kind of the same that we always do, but I want you to like think about this when you have someone also with, mostly with abdominal pain, okay? So for trans men as a patient, how they refer to their anatomy, okay? There's anatomically, we talk about vagina, we talk about like penis, testicles, what they may refer to the genitalia differently. So it's important that you ask them that question, especially when you're gonna do a physical exam. So ask them, how do you refer to your genitalia? And then if they like say, sometimes they laugh, it's like normal. Okay, so penis? Okay, vagina, just use the term anatomically and it's okay and it's correct and we know that. So, and as for consent, always, if you need to perform a pelvic exam, you're gonna use the smallest speculum available, or you can also use a anoscope. Giving the patient the overview of how you're gonna perform the exam and alert them how every step that you're gonna go through. The pelvic exam can be really traumatic, anxiety producing for these patients. And especially if they're going through, if they're taking hormones, that is gonna make their possible vagina, how they call it, very like dry because of a hypoestrogen state, and it's gonna be really painful. Okay, so just think about that. Okay, smallest speculum available. Okay. So trans women, if they have any affirming like surgery, use an anoscope. Definitely use an anoscope. Okay, because a pelvic, the speculum is really big, okay? So try to find one. If you don't have, I don't think that we have them in the ER, so you can call surgery. They likely have them, so they can bring you one, okay? Or possibly GYN upstairs. Ask them about particular practices like talking, if they don't have any like surgery, how many hours a day they do talking, what they use for talking also. And the same thing, if you think that they're like doing it safely, refer them to the clinic so they can have a conversation in there to do it better. Depending of the chief complaint, many patients will still have a prostate and you may need to do a prostate exam, okay? Which also can be anxiety producing for them because the gender dysphoria, okay? If whatever the patient went through surgery or no, will guide how you will do this. But if the patient has a vaginoplasty, you definitely need to use a anoscope, okay? It's gonna be at the new vagina, it's gonna be really small. The walls are gonna be really high, so it's gonna be really painful, okay? So you're gonna use an anoscope, you're gonna take the trochanter out, and then when you take the trochanter out, you're gonna be able to see the new vagina walls, okay? This is gonna be later in another presentation. Yeah, we're gonna do that. And what you're gonna do is okay? Yep. But it's a huge surgery, okay? It's like, and it's painful and they have a lot of risk, okay? So in summary, transparency and communication are key.
explain all the process, ask for consent, be flexible. In patients that usually you will do a pelvic exam or a pelvic ultrasound and they don't want you, it's okay, order the CAT scan. You're gonna die, okay? It's fine. Just be flexible. If they say like, no, I don't want that. That's fine. You explain to them, you know, I need this information, but I understand if you don't want to, we can order a CT scan, and that will be fine, okay? And I think that for me, that's it. Just be kind, be gentle, please learn. This is just for bringing curiosity to have a conversation and to start a conversation between us. And there's way more things that we need to learn because clearly they don't like to come to us because we're not ready. At least for me, that is something that I want to improve and I want our leaders to be ready for that. Okay. If you have any questions, email me and we can chat. And this is my reference and this is the post survey and then the feedback.